Okay, so I just continue on birth control. So learning outcome for this chapter, identify contraception and birth control method, understanding the underlying uh, of this birth control method. Okay, um, meaning, okay, saya tambah sini understand, sorry, control Z. Okay. Okay. Alright. So I add another learning outcome, understand and or identifying the underlying concepts of hormonal regulation or anatomical approach that being manipulated. Okay. Describe the application and the application and the effectiveness of the contraception and birth control method. Okay. Just now I just draw some like a mind map here, but you can do your own mind map. So under this chapter, so there are like three broader view of birth control. Okay. I guess the first one will be this one, abstinence. The second one is the permanent approach. Okay. The third one, the most broader or the most vast methods, okay, or approach is under temporary. So this one, temporary. So we have many equipment or many approach in terms of birth control methods. Okay, and then I did draw this one. So this this is represent the cycle, this the female cycle, and this is the hormonal regulation of female. Again, the male also, the men also have hormonal regulation. Nowadays, or the current technology or the current advancement in reproductive system or reproductive knowledge. They try to I mean scientists try to create, I think there are visible now, birth control pills for male. Okay, but previously most of the birth control method or the contraception is manipulating the female hormonal regulation. Okay, all right. Okay, that is the risk and responsibility. I think the first few slides here, it's like introduction, talking about responsibility or the integrity, is it the responsibility of intercourse? Okay. Okay, and also understanding the risk of intercourse. If intercourse occurs the day before ovulation, the chances of pregnancy is 30%. Okay, the day of ovulation, 15%. Okay, and over the course of 1 year, so this one might this percentage is by day. Okay, this is high enough, and I say also this is considered high enough for like a chances in a day. Over the course of 1 year, couples who do not use contraception have 90% chance of pregnancy. Okay. women and men and birth control, who is responsible? So this is basically the questions now. So before this or all this, mostly the concept or the understanding or the cultural point of view is the women. Okay, very old days, the women is responsible in terms of birth control. Okay, um, even in infertility case or infertility problem, all these our understanding or the oldest understanding is the women is is responsible. But with knowledge and science advancement, so now we understand better. Okay, so you can answer this. Traditionally has been the women's responsibility. Attitudes are changing nowadays, so it's both men and women. Okay, in addition to use a condom, man can help take contraceptive responsibility. Okay, okay, so this is basically knowledge on conception or coitus. Okay, so just a diagram here. That's all right. So what's the difference between birth control and contraception? So basically it's the same. Okay, birth control also known as contraception, but if we want to look in terms of the processes involved in reproduction, okay, uh, we can say conception is preventing the earlier process, which is preventing the uniting process, okay, or the fertilization or the meeting of the sperm and the egg. Okay, so if you want to give example here, like condom. Okay, condom preventing the sperm from meeting with the egg. Okay, birth control preventing birth from taking place. So this one is a bit later in terms of process in reproduction. But again, but overall, both of it is the same, preventing conception. Okay, conception. Apa tu? Inilah fertilization cuba tengok wording ya. Ataupun preventing birth lah. Alright. Alright, so contraceptives can help in preventing. Okay, so this is like example sterilization. Sterilization just now the permanent approach. Okay, is like sterilization here. The pills, we have the pill, we have IUD, intrauterine devices. Okay, IUD stand for intrauterine devices. Intra meaning inside the uterine devices. So this equipment here, this device will be put in the uterine cavity. Okay, and then next we have female condom. So although this female condom is not common, uncommon, but there are presence of female condom. Okay, hormonal patches. Okay, male condom, emergency contraceptive. So this one also like a pills tablet. Okay, same with pills, but this one the pills are taken in a more scheduled manner. Okay, so this one is a tablet also, but the term emergency here, so usually in certain cases or ad hoc manner lah. Okay, contraceptive injection also same with the pill, more scheduled manner. Okay, yes, hormonal patches also more scheduled manner. IUD. Okay, all right. So this method of contraception or birth control. So the first one, abstinence meaning like a fasting. Okay, siapa yang tak tahu So this one 100% effective in terms of controlling pregnancy. Okay, controlling birth control. Number 2 is permanent contraception. So here example, sterilization. In men we call it vasectomy or vas deferens removal, if I'm not mistaken. Okay. Saya tak tahu kenapa keluar benda ni tapi I hope you understand lah ni. Okay, vasectomy. Tubal ligation, so we manipulate the anatomy of the women in at the fallopian tube. Okay, fallopian tube, tubal ligation. Hysterectomy, the anatomy, we remove this part over here, the uterine, the uterus. Okay, vasectomy ni vas deferens lah. Okay, if I'm not mistaken, or the tubes. Yeah. Okay, so most of the approaches in birth control is the temporary contraception. So under this temporary contraception, three category or three region or in terms of processes. Okay, one in ovulation, we prevent the ovulation, or another approach is preventing the union of the sperm and egg, and next another approach or another scope is preventing implantation of the fertilized egg. So if you see this is like a process of reproductive, right? One cycle of reproductive. So produce gamete, okay, and this gamete available in the site of fertilization. So produce gamete, so this gamete develop and then eventually ovulate. Okay, so this is in a female. And then when ovulate at the site of fertilization, waiting to be fertilized. Fertilization. Okay, so and then implant. If fertilization occurs, so implantation, right? So as you can see, this temporary birth control or temporary contraception, we the scientists, the science advancement understand this facts here. Okay, so the scientists manipulate, or yeah, we can say manipulate the process in this pathway. Okay, we can take birth control that preventing the ovulation, whether it's a pills or hormonal patches or injection, or even if we do not control in terms of ovulation, we can prevent in terms of sperm and egg union. Okay, this one might be for example condom. Okay, maybe the girl or the women or the man, the married men and women here plan not to have babies. Okay, so the wife did not take any pills to so the wife did not take any pills to prevent the ovulation or to manipulate her cycle, so her cycle is normal. So in coitus or in intercourse, so the man wearing condom or the women also wearing condom, or even spermicide. Okay, so in terms of this approach, so we are manipulating the uniting of the sperm and egg. Okay, so this is just general discussion how we want to understand the birth control pills or the birth control approaches or method. Okay, and then so on, preventing implantation. So let's look at the elaboration here. Preventing ovulation, birth control pills. Okay, usually the birth control pills have high dose of estrogen or progesterone. Okay, it can be one of it, or it can be both, or it can be only estrogen or progesterone. Okay, so so by taking these pills that contain estrogen or progesterone, it will prevent ovulation. Okay, here we have example Norplan, Depo, Provera. So despite of you here, listening to my lecture here, You can always Google this brand here, or even you can always Google the birth control pills here, and share with us in the chat box the brand or even the types of birth control pills. Okay, so that if you not so that many people or many of your friends know. Okay, boleh cari sekarang sambil-sambil tu letak kat chat box so the example of birth control pills. So let me explain how these birth control pills that contain estrogen or progesterone prevent the ovulation. So to understand this, we will look at the that's why I draw this one, but I think I just use maybe this one. Okay. So this slide here is this is hormonal regulation of male, but we look into the hormonal regulation of female. So as you can, I hope by now you all already understand this concept and also memorize this hormonal regulation. So hypothalamus. Siapa yang rasa tak nampak lagi pathway hormonal regulation ni dalam reproduction, tolong check. Tolong cepat-cepat catch up lah. So kita dah cakap banyak kali dah pasal hormonal regulation ni. So kalau tak faham lagi atau masih confused atau serabut lagi benda ni, please talk to me or read and ask question with me, okay? So hypothalamus will release or secrete GnRH. Okay, so this GnRH will stimulate the anterior pituitary. Anterior pituitary stimulated, it will secrete FSH and LH. Okay, FSH will stimulate the ovarian, the ovaries, especially this one, the follicles, to grow. Okay, LH will stimulate also the follicle grow, especially the specific cells, T-ca cells. Remember we have T-ca cells and granulosa cells. Okay, at the same time, it also stimulate the receptor of LH and these cells over here. Okay. So and then when follicle grow, as these follicles many grow, it will release estradiol, estrogen. So this estrogen will eventually okay, so LH surge, it will cause the ovulation. Okay, so FSH, why FSH is not the FSH surge is not occurring at the same time, inhibin also produced by this follicle growth, so it will become a negative feedback of FSH secretion. Okay, so this one relate with this ovarian cycle and the uterine cycle. Okay, so just now the birth control pills have estrogen and progesterone, remember, whether it's a combination or progesterone. So this estrogen progesterone is actually become a negative feedback to kita kena guna ni lah. Okay. So progesterone or estrogen will also become a negative feedback for the hypothalamus and anterior pituitary. Okay, when the pills present with progesterone and estrogen, okay, it will give a negative feedback to the hypothalamus and anterior pituitary. Therefore, the GnRH will not be secreted. It will it only limit or at low level of GnRH. Anterior pituitary also will be inhibit to secrete FSH and LH. Okay, therefore no stimulator for the follicle to grow. Okay, When no follicle grow or no follicle develop into the mature or the tertiary stage, ovulation will not occur. Okay, so that's how the birth control pills with estrogen and progesterone um, cause effect to the hormonal regulation of the female. Okay. Okay. Thank you. Siapa yang dah tulis? Birth control pills, Epri, Livora. Okay. So if you try to find what contain in Livora and Epri here, your friend post here, you can know whether that birth control will have estrogen or progesterone or combination. Okay. Today's slide. Okay. Okay. So I hope you understand how this birth control pill prevent the ovulation. Okay. Preventing sperm and egg union. So yeah, here condom and diaphragm. Just now I elaborate how it prevent the sperm and egg union. Okay. Or natural way of determining fertile period of female. This natural way meaning manipulating the days that we understand. Okay, we have 0, 14 day at day 14 and 28 days. Okay, so for the married couple that planning not to have child yet, so understanding this cycle, the wife cycle, okay, to have sexual intercourse, okay, natural way of determining the fertile period. Next, preventing implantation of fertilized egg, IUD. So if you can see here, the picture here, these devices like a T shape here will be put in the uterus cavity here. So later on we have this slide. Hormonal methods, the pill, the birth control pills, the implant, the patches, okay, the injectable contraceptive. Okay, fertility awareness